Okay. Okay, so here we go again. Let's try this.
Okay.
Okay, I just want to welcome everyone to our program. This is Living Well. We do this every Saturday evening at 4:30, and I'm so glad for the faithful followers that we have here. So today we are going to be going over an interview with Dr. Perrott, and I'm so glad that Dr. Perrott can join us this afternoon. Everyone, for those of you who do not know Dr. Perrott, I just want to introduce her to you. Dr. Perrott is a practicing physician in the field of gynecology and obstetrician. She's also very interested in women's health or just healthy living. Also, she is well sought after in her field of study and also for doing lectures. It is my honor and our privilege to have her this afternoon to do this interview on the hormonal symphony. So when I think about the word symphony, I picture an orchestra with its various instruments harmonizing a complexity of various movements which connects to form a delightful musical masterpiece. If one player goes off tune, it diminishes the performance of the whole orchestra. Within our bodies, we have a symphony of hormones that create a harmonious masterpiece when all the different players working together to maintain the right balance. If any one of these hormones are out of balance, it can negatively affect the rest of our body, since the body works together as a whole and not separately. According to research, there are about 50 types of hormones within the human body. They control several functions like the metabolic, reproduction, growth, mood, and sexual health. Today, we are going to be focusing more on the female hormones. So Dr. Perrott, I'm going to bring you in, and I just have a few questions here for you. And audience, take notes. If you have any questions, I will, at the end of this, we will be able to ask our questions, okay? So Dr. Perrott, we'll be talking about the female hormone. I know you're well versed in this, and there's no other person better than you to answer these questions. So my first question is, what are the main hormones produced by the female body?
Okay, very, very good question. Let me first kind of define what a hormone is. You know, we hear the word hormone all the time. We think only of the female hormones, estrogen, testosterone, progesterone. And by the way, testosterone is considered classically a male hormone, but as a female, we also produce some testosterone as well. As a matter of fact, you got to understand that the ovaries produce testosterone first, and that changes into estrogen. So let me just kind of say, first of all, what is a hormone? A hormone is really a signaling molecule, that is, or a messenger that is produced in one area of the body and then is transported to a distant part of the body, and it affects our behavior or it affects our physiology. In medical school, we used to call it a ductless gland, because it's produced like insulin is produced by the pancreas and it goes wherever. Estrogen is produced by the ovaries and it goes wherever, through the blood. So hormones are produced in one area of the body and is used to produce some change in behavior, some change in physiology in another place. Now, whenever I talk about hormones and I describe what a hormone is and describe hormones, I always say this very statement, and I like to say it. God did not intend for us to be on hormonal replacement therapy, but he didn't create stress either. So here we are talking about this. So all our hormones in the body are designed, as Memlin says, to work together. If one is altered or different, it will affect the actions of the other. So let's describe the three main hormones that there's so much more of them, but I want to kind of describe the three main ones and then kind of touch on two others so that which you kind of didn't know, but I think it really works together. Now, the first is estrogen. We've heard about that. And I describe estrogen as, I call it the angel of light or the angel of death, because it can really help us, but it can kill us too if it's not balanced. So estrogen is, we have three kinds of estrogens in our bodies. We have one called estradiol, we have estrone, and estriol. There's much more, but there's main three: estradiol, estrone, and estriol. And estradiol is the one that's the most powerful. And every time you hear somebody has hot flushes and they use hormonal replacement therapy, they use estrogen, is estradiol is the one that's used to take away hot flushes. The other two are very weak estrogen. Estriol is a very weak estrogen. Estrone is more of a storage hormone. So I listed in order of potency: estradiol, estrone, and estriol. Estrogen has about 400, that's 400 crucial function in the body. And these are the crucial ones. I'm just dealing with the 400 crucial ones. There are receptors for estrogen all over your body, in the brain, in the muscle, in the bladder, in the eyes, in the gut, in the uterus, in the ovaries, in the vagina, in the breast, in the heart, in the lungs, in the blood vessels. So many places. There's receptors for estrogen. So it must be a good thing. If this is a ubiquitous hormone and God produced it, must be something good about it. Estrogen is lower in women who smoke. So women who smoke have somehow lower estrogen. And I find that these women will come into my office and they will complain of hot flushes a lot, okay? Because somehow the nicotine decreases free estrogen. Some other functions of estrogen in the body: it decreases wrinkles. It increases water content of the skin, which is responsible for skin thickness and softness. So as you get older, that's why your skin gets wrinkly, is because of a loss of estrogen. It decreases LDL. We know what LDL is. It decreases LDL, but increases HDL. So it has an effect on our cardiovascular system, okay? In fact, it increases HDL, it increases HDL, reducing heart disease overall 40 to 50% in women who have balanced hormones. It keeps our blood vessels open and improves blood flow. It prevents tooth loss, okay? It helps with the formation of neurotransmitters in the brain, such as serotonin. It decreases depression and anxiety and irritability. How many people, when they have low estrogen, if they're going through menopause, get very irritated, short-tempered, things they could have tolerated 20 years ago, they can't tolerate it? No, that's because of a decrease in estrogen. It maintains bone density. And you know what? It also protects you against macular degeneration. That is the area of the eye that gives you high focus. That area of the eye, in the back of the eye, on the retina, it actually protects our macula from degeneration. Now, what are some of the symptoms of estrogen deficiencies? Things like arthritis, you may get bladder problems, brittle hair, decreased breast size, decrease in sexual desire or interest, decreased memory. You have difficulty in losing weight, dry eyes, elevated cholesterol, chronic fatigue. All of these are symptoms of a decrease or deficiency in estrogen. You may also have increase in facial hair as well, increase in insulin resistance, increase in osteopenia and osteoporosis. You may have difficulty sleeping, vaginal dryness, weight gain, especially around the abdomen. All of these are from estrogen deficiency. Estrogen controls all of this. So when it begins to decline as we age, we get all of those symptoms. If you have too much estrogen, you may have to get to the point where you have quite a bit of estrogen. If I have a chance, maybe at the end, I can share a screen and I can show you some slides of what I want to show about estrogen dominance. If you have too much estrogen, that means if you have one hormone, for instance, progesterone, that is less than the estrogen and doesn't balance well, you may get bloating, you may get fibrocystic disease, you may have elevated risk of breast cancer, headaches, heavy menstrual flow, fibroids, hypothyroidism, autoimmune disease, uterine cancers, mood swings, poor sleep, water retention, weight gain, especially around the hip and the thigh area. So in other words, if your estrogen is not balanced, and if the balance comes out where it looks as if you have too much estrogen, you can get those symptoms I described, which is symptoms of estrogen excess, which is fibroids, heavy bleeding, bloating, weight gain, autoimmune diseases, breast cancer issues, fibrocystic changes. So you see how important it is to balance your estrogen well. Now, let me talk a little bit about estrone. That was estradiol. That was the total, what I just said is about estrogen in its entirety. But let's talk a little bit about estrone, the one of the estrogen. Remember, there are three kinds of estrogen. We have estradiol, estrone, and estriol. Estrone is the main estrogen that your body produces. High levels can stimulate breast and ovarian tissue. So estrone is really a storage hormone. When your body is low in estrogen, low in estradiol, for instance, estrone is converted into estradiol. But in the postmenopausal period, very little estradiol gets converted from your estrone. The result of that is that there's high level of estrone, and that increases your risk of breast cancer. So they got ways of decreasing that. Estradiol, as we know, we talked about that before, is the strongest of all. Let's talk about estriol. Estriol is it's my favorite estrogen for people who have very low estrogen within the vaginal tissue, because estradiol is really a very anti-proliferative type estrogen. It has less stimulatory effect on the breast and the uterus. It protects you from breast cancer, by the way. So this is one of the estrogens that will protect you from breast cancer. Not all estrogen is bad. This one is protective. So therefore, when we're balanced in estrogen, you want to make sure that the levels of estrogen, all of the levels of estrogen is at its right levels, so that it all do what it's supposed to do. Now, estrogen has two main receptor sites. You have an estrogen alpha receptor site and a beta receptor site. And I'll tell you how important that is later on when I talk about soy. Two receptors for estrogen. Estrogen is alpha and a beta. Alpha increases cell growth and beta decreases cell growth. And E1, which is estradiol, mainly binds to estrogen alpha, and E2 and E3 binds to the beta in a 3-to-1 ratio. It is believed that this selective binding imparts E3, which is estriol, a potential for breast cancer prevention. So if you can get more of your estriol to bind, you will have less risk of breast cancer. And by the way, there are some foods that will do that, and I will tell you that later. There are some foods that gives you a lot of estriol and helps that binding so it decreases cell proliferation. So the estrogen that your body produces, when your body produces estrogen from the ovaries, it goes and does what it's supposed to do, and within 24 hours, it should go away. Now, there are some synthetic estrogens they used to call it natural estrogen, but right now, I call it synthetic estrogens, like Perrott, for instance. It can take up to 13 weeks to get out of your system. So Perrott is an estrogen that, by the way, I'm guilty. I've prescribed it in the past because that's all we had and we didn't know better. But Perrott is an estrogen from horses, actually it's from horses' urine, the very word Perrott, pregnant mares. So they took pregnant horses. A female horse is called a mare, and they took the urine and they extracted an equine estrogen, and that's Perrott. And it can take about 13 weeks to get out of our system. A natural estrogen in our body takes 24 hours to get out. So if you have something that's circulating around in your body, it can go back and cause problems. So it's better to eliminate as best you can. I can go into a lot more about that. I'll talk about it a little bit later. I want to go on to progesterone. progesterone. So now we dealt with, let's do the summary. We dealt with estrogen. We have 3 estrogens: estrone, estriol, estradiol. Estradiol is the most potent of all, and it's the one that takes care of all the stuff that we talked about. There's about 400 uses. Whenever there's deficiency, we can have a whole lot of stuff, including arthritis, weight gain, etc. Whenever there's excess, we can have other stuff such as breast cancer and autoimmune diseases and all kinds of diseases. Now let's talk about progesterone. The very word progest is the hormone really of pregnancy. Progest. It's the hormone that keeps you pregnant. But they work together. Estrogen and progesterone works together. So it's a sex hormone made in the ovaries until up to menopause. So it's made until menopause. After menopause, I have checked levels in women who are in their 50s, and it's actually practically zero. It shouldn't be. You can get progesterone from your foods. You can get your ovaries produce some progesterone, and of course, when your ovaries stop functioning, your adrenal glands will produce progesterone for you. And by the way, fat cells produce estrogen. So if you are overweight, you're going to get much more estrogen than is needed, and you are now increasing your risk of all those diseases that I just described. Okay, so progesterone. What are the functions of progesterone? The first function, it balances estrogen. So progesterone is known for balancing estrogen. Without progesterone, the estrogen goes awry and does wild stuff. So you need a certain amount of progesterone to balance your estrogen. It helps with bladder function. It improves sleep patterns, and it helps with bone building. Let me talk about sleep patterns. It is really the hormone of sleep. Progesterone is like a sleeping pill. I actually give it to women for sleeping. It also will reduce stress as well. It prevents anxiety and improves mood and irritabilities. If when you become menopausal, you get a little irritable, that is because of your changing progesterone. If you don't have any, it will cause mood changes. It relaxes smooth muscle of the gut so that the body can break down food into nutrients with adequate absorption. You see how all of these sex hormone does all kinds of stuff? And here are some symptoms of progesterone deficiency: insomnia, depression, anxiety. So if you have no progesterone, you can difficulty sleeping. You may have depression and anxiety. You may have decreased sexual desire, excessive menstrual flow, osteoporosis, weight gain, and water retention. Now, what are some of the causes of progesterone deficiency? The big cause is nutrient deficiency. If you are deficient in vitamin B, if you're deficient in zinc, if you're deficient in vitamin C, if you're deficient, if you eat a lot of saturated fats and sugars, you will have a decrease in progesterone, and that would affect your uterus. Now you'll have excess estrogen, and you're going to develop fibroids and abnormal bleeding. So one of the most common things I see in the perimenopause is progesterone deficiency. So your thyroid won't function well. You can have increase in prolactin production. Progesterone is the hormone I actually like. I would replace progesterone on patients before I replace estrogen, because it's a safe hormone. You literally can give a whole ton of it and nothing will happen to the patient except they may fall asleep during the day and you can back off on it. Progesterone, unlike estrogen, can be used alone, but it can work best if a heart flushes if you use a little bit of estrogen along with it. And I have used it in a prolonged fashion. Let me do, I know time is going, and we have a lot of other questions, so let me just do a little testosterone, and then we can move on to another question. Testosterone is, we call it a male hormone, but actually we produce it as well. We produce quite a bit of it, as a matter of fact. It's called a male hormone because it has of the male-like characteristic. It is made in the adrenal gland and the ovaries, and functions. It elevates norepinephrine in the brain, which has the effect as an antidepressant. So when you use testosterone, you have a sense of well-being. There's a whole bunch of doctors out there that are putting in testosterone pellets And patients tell me they feel great. And after a few months, they come to me with bleeding. I take care of the problem because the problem with testosterone, it changes into estrogen. So you have to be very, very careful. That's his job. His job is to aromatize. The word is aromatize. There's a special enzyme for that. And so it aromatizes into estrogen. So you have to be very careful with that. Testosterone deficiencies, if your testosterone is low, you would have, if your testosterone is low, you have really a decreased fatigue. You get really fatigued, decreased interest in everything, loss of memory, loss of muscle tone, decreases in sexual interest. They all do that. And they can cause you to feel very, very not with it. So I always check those levels when patient comes in with fatigue. Some deficiency issues. If you have any kind of deficiency or causes of deficiency would be, if you just have a child, childbirth can cause you to have a decrease in testosterone, chemotherapy, birth control pills, cholesterol lowering medication, and menopause. All of these can cause you to have a deficiency in testosterone. And to improve testosterone, you got to eat well, health, exercise, and optimize all your other hormones to actually get you to have balance. Now, there are two other hormones I want to look at, and DHEA and melatonin. I want to stop there. In case we have time, I'll talk about it because I know there's a lot of questions that you have.
Wow, that is so interesting to hear all of these hormones, as I said, working together as a symphony to balance everything out, and we have to be careful in what we take, because you were talking about Premarin. I know that's a hormone that was used in the past to regulate estrogen and hot flashes and all of that. And it lasts so long in the system. So how can we replace hormones naturally? Is there a natural way to replace our hormones?
Yes, there is. There are many ways to replace hormones. First of all, let me just say that you don't have to be on hormonal replacement therapy to replace hormones. In fact, my first line is never to use hormonal replacement therapy if the patient has symptoms. I would first begin to change your lifestyle first. And by the foods you eat, exercise, restoring of your circadian rhythm. Let me talk first about restoring of your circadian rhythm, because the restoration of your circadian rhythm restores your hormonal balance. By restoring circadian rhythm, I mean getting out in the morning for a 30 to 40 minutes, 30 minutes for the least of morning sunlight will restore your circadian rhythm, and that will increase your estrogen. That has been known to do that. So just that alone would do that. Exercise will also do it as well. But the restoration of the circadian rhythm is one of the greatest things to actually get you to have hormonal balance. And sometimes we are so depleted of hormones because we have been under stress so much that we have to use something to replace it. So if lifestyle doesn't work, I begin to replace the nutrients that can actually cause your hormones to improve. So the nutrients are like all of your B vitamins would do it. All of your B vitamins, zinc, and then I explain to you the foods that have that. And sometimes I have to give you supplements for a short period of time that have that, as well as the foods to improve your body making its own natural hormones. And if that doesn't work, then I begin to replace a little bit of hormones. I first replace progesterone, and the progesterone I use is a natural progesterone. It's not synthetic. It's extracted from the plants. As a matter of fact, it's extracted from the wild yams. Now, to get that kind of hormone, you have to get it not from every pharmacy would prescribe this, would dispense this, excuse me. It has to be from a compounding pharmacy. So you have to go to a physician who does natural or bioidentical hormone to get that. But remember I said, that's the last resort. Remember I said, you asked the question, how could we replace it naturally? Well, we replace it naturally by a change in lifestyle. Where sometimes I have to supplement a little bit because we are so depleted, I have to supplement. And then the last stage, of course, is to use a little bit of bioidentical hormones, which you can get only from a compounding pharmacy and from a physician who prescribes that kind of medication.
Okay, wonderful. You know, we have often heard about soya is a good replacement therapy for hot flashes and all of that. And then again, we also hear that soya can cause breast cancer. So can you give us enlighten us on that? Can soya cause breast cancer? And you know, and hormonal therapy cause breast cancer?
Cause with breast cancer. Well, let me, it's a very good question, first of all, and it's a question that I can speak all day about. So let me see what's the most important thing that I can say. I have to give you a little bit of a historical background first to answer part of that question. The historical background is there was a study that was done maybe about 15 to 20 years ago that indicates that hormonal replacement therapy can cause breast cancer. In fact, there was an increase and they had to stop the study. The hormones that were studied were Perrott and Perrott. Perrott, I mentioned before, is an equine estrogen, and Perrott is a progesterone, but it's not a natural progesterone. It is a synthetic progesterone, and they combined it into one pill, and we called it Prem-Pro. And by the way, I'm guilty at the time, 20 years ago, of prescribing all of that stuff. And we anecdotally had said, oh, estrogen doesn't cause breast cancer. So this company decided they're going to study this, and they did. And they studied it for about 5 years. They gave women who had a uterus estrogen and Premarin and Provera, and then they gave some of them nothing, which is placebo, and then they gave some of them only Premarin only, those without a uterus, only Premarin. And they had to stop the study after about 3 years. They didn't even get up to the 5 years because they begun to see an increase in breast cancer. Then they found out after careful analysis, it was the synthetic progesterone, the Provera, added to the estrogen that increases the risk of breast cancer. So the answer is yes, from that perspective. The answer is yes, that some estrogen therapy can do that. But not all estrogen therapy is. Remember, I told you there are some estrogens that are protective. Estriol is protective. It'll protect you against breast cancer. So the question is, does hormonal replacement therapy cause that? The answer is yes. We knew it did in the past. That certain kind of Premarin and progesterone, or certain kind of synthetic can, because it stays in the body so long and it stays in the body enough to do damage. But the natural progesterone that you get in from food, the bioidentical progesterone, has not been shown to actually cause an increase in breast cancer, because I think we monitor it so much. Okay, so that is still something that we're working on. So, you know, I always caution patients and I tell patients that hormones are hormones, and we still have to monitor them, and we don't know how your body will work with it, but we haven't been showing any increased risk using a more natural approach to estrogen. Now let's look at soy. I want to say something about soy because you asked a question about soy. Soy, the bean that God made, I always say. Remember, I talked in the past that we have 2 receptors for estrogen, an alpha receptor and a beta receptor. Well, apparently soy binds to a beta receptor. It does not bind to the same receptor that that other kinds of estrogen does. And that beta receptor is protective. So soy will take away hot flushes, binding to another kind of receptor does not promote breast cancer. Now, a lot of doctors would, let me back up a little bit. There are patients who have breast cancer, and when they go to the oncologist will tell them, don't eat any soy. Well, that's wrong. It's actually wrong. Soy does not cause breast cancer. As a matter of fact, we've heard about the BRCA gene 1 and 2. You know what they are? The BRCA genes are tumor suppressor genes. We all have that as we're sitting here. We all have a BRCA gene 1 and 2. The people who have BRCA gene mutation, which is a change in that gene, which accounts to 2 to 3%, 5% for the most of breast cancers, have a mutation in that gene that actually can cause an increased risk of breast cancer. So the purpose of the BRCA gene is to prevent you from getting breast cancer. You know what soy does? It turns it on. Soy turns on your BRCA gene. So the more soy you eat, not processed soy, the much soy you eat in its natural form, it will actually promote and turn on that gene. So it works better. So it prevents you from getting breast cancer. Okay.
Wow. Wonderful. Thanks for that clarification, because I know I have been going around very skeptical about soy because of the fact that it can increase breast cancer. But now we have it all clarified that it is a protective gene. It works on the beta cells and binds to the beta cell, which is protective, and also helps with that BRCA gene, which protects us from breast cancer. That is good to know.
And people are probably asking the question, well, then if we have all this stuff, if we have all the BRCA gene, why do some people still get breast cancer? Well, apparently the tumor turns it off or suppresses it. Okay. So a lot of the studies that was done in Asian women, they have found that when they have breast cancer, these are women who already been diagnosed with breast cancer. They got the breast cancer and they give them soy in its natural form. I keep saying that, in its natural form. These women are able to turn back on that BRCA gene because the tumor suppresses it, and somehow soy is able to turn it back on when you already. So people who have breast cancer and eat soy have less reoccurrence of their breast cancer. That you don't hear from an oncologist.
Wow, that is something so important to discuss with patients so that patients can take better care of themselves. And you know, you're talking about Asian women. I'm wondering how frequent is breast cancer in that population, that group of ladies, because they eat a lot of soy.
They eat a lot of soy, so their breast cancer is less. In fact, all of the studies that were done with them. Their reoccurrence, there's lots of studies were done showing the reoccurrence is less when they eat soy. So if you take that same Asian woman and bring her to the United States, and she begins to eat less soy or more westernized diet, their rate of breast cancer now equals that of ours, as opposed to in Japan, you know, where they eat soy. Yeah.
Yes, I know we have to be very careful, because I know you were talking about, you keep emphasizing soy in its natural state.
Natural form. And I think the natural form. Let me just say this. There was a study that was done recently for hot flushes with soy. And they found that women who eat, it's called a WAVE study, WAV study. They did a study. It was a very small study. It was only about 15 women, but they gave them the vegan diet. I hate to use the word vegan, let me use it differently. Whole food, plant-based nutrition. And they found that these women, even though they had whole food, plant-based nutrition, their hot flushes declined some. But then they gave others whole food, plant-based nutrition with half a cup of cooked soy. And in 3 to 4 days, all their hot flushes were gone. So I said, okay, I'm going to try it myself. So I went to Amazon, about 5 bags of soy. Okay, just the soy in its natural form. It's only about $5. You know, big bag soy, beans, dry beans. You soak it overnight, and I cook it. I just cook it. And I began to make hummus with it, and I put it in the oven. I make roasted soy with it, and I would literally, it does work.
Mm-hmm. Right.
It does work. And this is the natural soy. This is, I call it this bean that this is not processed soy. This is not soy isolates. This is not fermented soy. This is the bean. Now, edamame works, but it doesn't seem to have all of the soy products, the soy protein developed in it to actually remove all of your hot flushes. It does work. So you need the actual bean in its maturity, because edamame is more of a young soybean.
Right, right, yeah. Right. Okay. And with all these foods that they're these refined foods that are packaged in packages, right, they have a lot of soy in there, but we have to be careful, because that's the refined type of soy.
Refined soy.
And that is where we run into the problem.
Right.
Soy. When it's in its reformed state. Wow, this is just so much wonderful information that we are receiving here today. You talk about breast cancer. I was just wondering, when we have to do not therapy, but diagnosis for breast cancer, one of the main things that we do, mammograms. We do a lot of mammograms. So I'm wondering, I'm hear some people say mammograms can cause cancer. And others are saying we need mammograms to detect breast cancer to prevent mortality. So can mammogram screening reduce breast cancer mortality?
Well, the answer is no. I mean, and this sounds really bad. Now the one thing I want to leave here with is this, for you to understand this, besides all that estrogen and progesterone and testosterone I talk about, the cancers you treat is the cancer you prevent. When you write it down, the cancer you treat is the cancer you prevent. What that means is this. Let me just tell you what I mean by that, by telling you this piece of biological information. Many of us, well, let me tell you the statistic. 20 to 24%, 20% of young people 20 to 24 years old, when an autopsy is done, there's already a cancer there of the breast. So if you take young girls in their 20s, died in a motor vehicle accident, and an autopsy is done, there's already a benign occult tumor, 20%. And she can live her entire life and it not happen. Or for some reason, it happens. What makes it happen? We don't know. We're thinking that breast cancer starts in utero. Could we prevent that? It starts in utero. In other words, in the uterus of your mother, you already have the breast cancer. Okay? And it has to do with what mom eats. Not only that, but what grandmother eats, really. You now, 2 generations down, you get the breast cancer. But the cancer we treat is the cancer we prevent is the cancer we treat. In other words, we can treat and prevent the thing at the same time. So by our lifestyle, because we know by eating certain foods, the trigger that cause the tumor to produce this special messenger called VEGF, VEGF. VEGF is something that all tumors produce that makes them get a lot of blood supply, so then it begins to grow. There are foods, all the whole foods that we have, it actually prevents that from happening. So if you can eat whole foods throughout your life, you literally can prevent a thing that you may have there from materializing into a cancer, into any disease, actually.
Okay.
We're beginning to learn this. We're beginning to learn this from the foods, that we're eating. There's research that is done on that. So the cancer you treat with cancer, you prevent. So could mammogram do this? So what I'm trying to say is, so knowing that piece of information, by the time a mammogram is done, even though the mammogram is negative, you may already have a cancer. So you heard people, and I've had patients say that all the time, they have negative mammogram. There's one day, there's this mammogram with this one less than 1 centimeter mass on it, that they couldn't feel even, so mammograms does not prevent cancers. Mammogram only picks up cancers in early phases. And by the way, I know they say that the amount of radiation that you use doesn't give you cancer, but it does. It does. And every single radiologist knows this. But we're saying, okay, if we can pick up a cancer really early and save that patient life, we'll take the chance of picking up that cancer early and to getting another cancer, like thyroid cancer, for instance, from all of the radiation that you have gotten. And that's why in my practice, I recommend thermograms along with mammograms. I don't use, I'm not saying that the thermogram is the gold standard. I'm not saying that. I'm saying reduce your radiation a little bit by throwing in a thermogram in there now and then. So you don't have a mammogram from the time you're age 40 or 45 every year of your life, which, by the way, accumulates and doesn't get out of your body, by the way.
Right.
That's what I say. And of course, good lifestyle changes. I sound like a heretic for saying that. Did any doctor hear me say that? But good lifestyle changes also would prevent you from getting any kind of disease. At least can treat or prevent you from getting any kind of diseases.
Well, that's the key. Lifestyle changes. That's our key. That's our key. Let us remember that lifestyle changes. And there's just so many questions more I wanted to ask you, but I'm just going to make this my final one. The interaction between hormones and the immune system.
Immune system. Well, I threw that question. I think this is a good question that you have asked because of the
life we're living in right now.
The life we're living in right now. And I want to say there was a study that was done about anxiety, especially now over the last year or two, and they have found that the people who are the most anxious are the ones who get the disease the most. It's somehow anxiety increases your risk of getting disease because the anxiety depresses your immune system. So one thing you got to understand that every immune cell they have receptors for all our hormones. So immune cells have receptors for hormones. So therefore, they work together. So if our immune cells are depressed for some reason due to stress, which is the most common way or most common reason for depression of your immunity, which in stress increases cortisol, and cortisol depresses your immune system. It will also depress your hormones, and your hormones will get impaired. One of the first things that I do, I always ask the question of anxiety and mood changes and irritability. And if I balance the hormones, you also balance your immunity as well. So they work together because they have receptors for your hormones on your immune cells.
Wonderful. Thank you so much, Dr. Perrott. I know there will be questions from the audience, so we would like to see what questions the audience have. You can write it in the chat if you don't want to verbalize. I just want everybody to know if they're speaking that they're recorded, so you don't want to be verbalized, you can write your question in the chat. And let me see. So we have from one of our participants, can low testosterone cause some of the someone to have a period for over a month when tests are done, and can they come and maybe can it come back good?
Okay. So I'm not sure, can low testosterone cause some to have, yes. But I think I think we're missing something in the picture here, and you need a more comprehensive hormonal panel to really answer that question adequately. But I will stretch and say yes, because if the testosterone is low, it means that your progesterone and other hormones are also low, and therefore an unbalance, and therefore it can cause that. Yes.
Okay. Yes. Anyone else? I only saw one. At what age can a woman expect hormones to be low?
Okay, very good question. That's a very good question. You know, if you were to ask me that question 20 years ago, I would say in the perimenopausal phase, which usually begins about 8 years. Well, by the way, let me just say this. Menopause is genetically determined. The age in which you go through menopause is genetically determined, meaning I always ask my patient, when did your mother go through menopause, or your aunt, or her sisters, or whatever, or your grandparents, or whatever? Because if you went through menopause around age 48, 50, you probably will go through menopause about the same. It's genetically determined. It's written in the stars. It's written in our genes, exactly the time you're going to go through. You know, there are some other extenuating factors that may affect it, but generally, if all things equal, there's a time for you to go through menopause. But there's a time before menopause, which is called the perimenopausal phase. And it's usually about 3 to 8 years prior to that specific time in which your body will go through menopause, which, by the way, the average age is 51. 51 is the average age for menopause. So maybe around 40s, mid 40s to late 40s, like 43 to maybe to 50, is what we call the perimenopausal phase, where your hormones are erratic. One day is high, one day is low, one day it's all over the place. And stress and the stressful life and the busy life in which we live adds to it. So the question, at what age can a woman expect low hormones? About in the perimenopausal phase. But over the last 2 or 3 years, just before the pandemic, I'm beginning to see young patients in my clinic with low hormones because of the stressful life in which we live. You see what I'm saying? They get low hormones, but typically it's around the perimenopausal phase.
Wow, thank you. Okay, we have another question. What does a hormone screen look like when checking to see if your hormones are balanced?
Good question. I'm glad you asked that question. I'm glad you asked. When I check hormonal levels, I check it in 4 areas. The first thing I do is I check a level of estradiol, testosterone, and progesterone. Those are the first 3 that I check. Then I check blood sugar control, which is insulin level and hemoglobin A1C. Then I check your stress level, which is cortisol level and DHEA, and I check thyroid. And when I check thyroid, I check the full panel. So I do a TSH, a free T3, free T4, and I also check an antibody to the thyroid as well. So I check hormonal levels in 4 areas. Not a common thing. You know, if you go to any physician, that you're not going to hear that. So you may want to take all that stuff that I just said there and ask your doctor to check it that way for you, because all of those things affect your moods and affect, they interact. Remember I talked about that symphony? Mm-hmm. Those are the 4 main players. The main players in the symphony is those 4 areas.
All right, that's very good information, and thanks for answering.
Somebody is asking a question. I have moods, and what can I do to stop it? Well, if you balance your hormones, you can balance your moods.
Okay, very good.
Emily.
Yes.
Hi, Dr. Perrott. So when I got tested by my gynecologist, he said my hormone levels were high. But I think shortly after I had my gynae checkup, I stopped seeing my period, and I'm 53. But the thing I noticed is that I have hot flashes, but I don't really have a lot of hot flashes and maybe require hormone replacement like some people. So is it possible for your hormones to be at good levels, and yet you still don't see a period? Because I guess maybe that's my case. Is it?
Yes. The answer is yes, because remember we talk about that symphony, everything has to be balanced well. So one could be high or you know, but another one is really low and it's affected. You have to balance things well. And by the way, hot flushes is the reason why I check it in 4 areas. I check it in 4 areas because I realized over time that it's not just a simple estrogen, progesterone, testosterone thing that actually causes hot flushes. But if your blood sugar is out of control, you will get hot flushes at 2 a.m. in the morning. How many people get a hot flush between 2 and 5 a.m.? Because because the hot blood sugar gets really low, your cortisol gets really high, you're like hot flush, you know. If your progesterone is low, you'll get hot flushes. If your thyroid is not working well, you'll get a hot flush. Right. So what I'm saying, so it's not just estrogen and progesterone, it's that symphony of thing that you gotta improve. And that's where your lifestyle comes in. Right. Sometimes you have to leave things out.
Yes, I tell you, we can go on and on. There's so much to talk about in this area. Maybe we have to come back and visit this area again. But that is so true. Lifestyle change, lifestyle. Our last question here is I guess what's the how to protect you from radiation? I guess you were talking about the tomogram instead of doing mammogram.
Yeah, I kind of understand the question. Is a very it's a question that we don't have a clear answer to. What is given when taking mammograms to protect from the radiation? Radiation, when they give you the radiation, every radiologist will tell you the amount of radiation you get from a mammogram is very small amount. But if you're doing mammograms on a yearly basis since age 40, and if after they do one mammogram, they say, no, I think you need to do another one because I didn't see, well, now you get 2 or 3 doses in that 1 year, it accumulates. The radiation cannot get out of the body, it accumulates. You may have to find a way to detox, and I don't always know. So I tell my patients, well, you got to do something. So I would recommend that occasion that you don't do mammograms every year. Now, let me just say this. We know that breast cancer is already there, and we haven't seen much of a change in mammograms that prevents mortality. Breast cancer comes back, doesn't matter what, it kills you. So you got to prevent it. I don't think of as a physician, we don't talk enough about prevention. We talk, okay, we could fix it, but we don't say, okay, we could prevent it. We don't talk enough about prevention. I find that to be a difficult thing for me to swallow at times, and it frustrates me that we don't talk enough about that. So that's why I add the thermogram in there. But I want to tell patients about the cruciferous vegetables. Do you know the cruciferous vegetables? That's a vegetable with a cross on it. Cabbage, broccoli, kale, all the greens, kale and all those greens, not spinach, not one of those, Brussels sprouts, cauliflower, they are called the cruciferous vegetables, and they have something in it called DIM, D-I-M. And DIM is important for taking the estrogen that your body produces and directing it into a pathway that gives you more estriol and gives you more protective estrogen. If it doesn't do that, and you have excessive estrogen, it will go down a pathway that actually increases your risk and cause DNA damage and will cause you to get the breast cancer because of the DNA damage. Well, these cruciferous vegetables prevent that. So you want to eat cruciferous vegetables often. Literally, you want to eat it every day. You want to eat some form of it every day. Half a cup of cooked vegetable, 1 cup of raw vegetable is a serving of green vegetables every day. So cabbage, Brussels sprouts, broccoli, kale,
Cauliflower.
cauliflower, Oh, and if you can't do that, try DIM. Go to a health food store and get DIM, DIM. DIM.
Yeah, wonderful. Okay, I keep saying this is the last question, but someone is asking about my granddaughter has hair on her face. Is it hormone imbalance? And what can she do to get rid of it?
Yes, it can be hormonal imbalance, and she needs to go to her, I don't know how old she is, but her gynecologist, pediatrician, and have them do a testosterone level on her. She may have PCOS possibly that needs to be diagnosed.
Yeah. Okay, wonderful. So we're going to end this right now. So her granddaughter is 18, she said.
Okay.
Yeah. So Dr. Perrott, before we leave, is there any final words you have to say?
Well, the big thing here is that, as I said before, the cancer you treat is cancer you prevent. And
Yeah.
but there is what I call a unifying theory of lifestyle, meaning people who have prostate cancer and breast cancer and heart disease and other kinds of cancer and autoimmune disease, they all come from one source. They're all the same thing, and you can prevent it the same way. The medicine, is food and our diet and our lifestyle. And if there's anything I want you to take away from all this talk and everything that we have been doing over the last few weeks or months, is lifestyle changes is the best medicine.
Right, thank you. And we're going to end on that note. I just want to thank everyone for coming and joining us. I don't know, we always end with prayer. Prayer requests. Anyone has a prayer request, they can put up on the chat now. We're going to go ahead and end here with prayer. When we do that, we usually stop recording. Can you stop recording, Dr. Perrott, please?
Yes, I could do that. There you go.